Good evening, and thank you for joining us. My name is Corey Nettles, and I have the great honor and pleasure of being the current chair of the Board of Trustees for the Medical College of Wisconsin. This is our weekly community town hall, and we are intending to continue to do these weekly through May, so we hope that you will continue to join us. I also want to say at the front end that we encourage you to submit your questions throughout the entire discussion. As you hear things that are said by the speaker that generate questions or thoughts, please feel free to lob those in along the way. So we'll be sorting and aggregating those and then asking them throughout our Q&A session toward the end of our presentation. Our goal through these town halls is to bring accurate and actionable information to members of our community and to answer questions that you might have about what the current state of COVID-19 is and what you can do to best protect yourself and your family. We ask that you help us with this. As you learn things here tonight that are relevant and that are helpful, please spread the word. We want to do everything we can to keep everyone in our community safe. We also invite you to visit our website at the Medical College of Wisconsin, where we will not only be uploading these presentations, but we do our best to provide real-time actionable information about COVID-19 as it becomes available to us. Tonight, like other weeks, we have another all-star panel of experts to provide their perspectives on key information regarding COVID-19 and to answer your questions. Starting us off will be Dr. John Raymond, who is President and CEO of the Medical College of Wisconsin. We also have Dr. Leonard Aghetti, who is Director for the Center for Advancing Population Science at MCW. We have Dr. Erica Arrington, who's Assistant Professor in Child and Adolescent Psychiatry at MCW. She also is the Program Director for Child and Adolescent Psychiatry Program at MCW. And last and certainly not least, we're very excited to have with us tonight Dr. Maria Elena Perez. She is a psychologist and Vice President of Behavioral Health at the 16th Street Community. Thank you all so much for being with us. Raymond?
Thanks, Corey. Could I have the first slide, please? I'd like to begin by thanking all of you for joining us tonight. We've been holding these town halls for about a month, and we've built many new connections and partnerships that have helped to guide us through these initial phases of the coronavirus pandemic here. And I hope that we can grow those partnerships and sustain them into the future. So again, I'm very grateful to all of you for joining. And since we began providing these updates at these community town hall meetings, we've been tracking the daily growth rate, the doubling time, and the number of new positive cases of coronavirus each day over the last month. And all of you have worked so hard to slow the spread of the coronavirus. And I think we in Milwaukee have a lot to be proud of because we've done a really good job. And that information is shown here on this slide. Now, 3 important things have happened over the last week. There was a significant increase in the number of tests being conducted, not just here, but throughout the entire state of Wisconsin. And that's important for us to go forward so that we can really understand how this pandemic is influencing our communities. And the governor announced the Badger Bounce Back Plan last year. And then finally, today, some safer at home restrictions were lifted to allow curbside pickup for non-essential businesses, rentals of outdoor recreational equipment, and car washes. And I think these are important steps forward. Now, with the increase in testing, we do expect to see a very large increase in the number of positive coronavirus tests. And as we move into the next few weeks, we'll need to be tracking different metrics so that we can align with the Badger Bounce Back. Wisconsin's Safer at Home extension does provide a lot of flexibility, maybe more so even than some states surrounding us, but that flexibility comes with some risk. Most of the risks are addressed in the Badger Bounce Back Plan. I'd like to just mention a few of those. We need more testing. We need our public health leaders to have the tools they need for surveillance and tracing of coronavirus. We need to increase our efforts in communities of color and in other at-risk living and working environments. We need to help our employers keep their employees and customers safe. And we need to be careful that there's not another surge of coronavirus in our community. And we need people to know how they can be safe where they live and where they work. If I could see the next slide, please. Now, with the increased number of tests at the end of last week, we know that we're going to detect more people who are infected with coronavirus. And as you can see on this slide, the positive tests are shown in pink and the total tests are shown in light blue bars. And you can see that those have increased over the last few days. We also plan to track the percentage of positive cases as shown by the black lines on each of the panels. Now, these are part of the Badger Bounce Back plan, so it's important that we align with the plan and show that every data that we have to the public. If I could see the next slide, please. We've been talking a lot about shortages of personal protective equipment that make it difficult for us to treat patients with coronavirus, and in fact, maybe make it difficult for people working in the community to feel safe. Although there still are serious supply chain issues for this personal protective equipment, like masks, gowns, and face shields, you can see some recent improvement shown by the downward trend of the number of hospitals in our region and in Wisconsin that have critical shortages of personal protective equipment as measured by 7-day supplies on hand. But we know that personal protective equipment shortages are going to remain a challenge for us going forward. Next slide, please. Because we flattened the curve in Wisconsin and Milwaukee, we've not overwhelmed our intensive care units with coronavirus patients, and that's really outstanding progress for all of us. And we can see here on this slide that the trends continue to go in the correct direction with a slow decrease in coronavirus-related ICU admissions. And again, this is good news for all of us. If I could see the next slide, please. Now, as we move out of the crisis and into a new phase of recovery, the choices that we make at home and at work really matter. Coronavirus is still a highly contagious and potentially deadly disease. And without a vaccine or good treatment, we still need physical or social distancing, to wear face coverings, and to wash our hands and touch surfaces frequently. I know that all of us want to get back to a normal life, but we still need to stay home as much as possible, to wear a cloth face covering when we leave home, and to keep a safe 6-foot distance between us and people who don't live with us. So again, I want to thank you so much for your partnership and for joining us tonight. And I'd like to hand over the presentation now to Dr. Leonard Aghetti.
Next slide. Thank you, Dr. President Raymond. I would now start off by talking about the idea that we have a new normal. And what this means is that life as we knew it pre-COVID-19 has really changed. And however, we also need to continue to use health services as we've always done. So hospitals, clinics, and the federally qualified health centers are still providing essential services. So I would say to community members, do not hold back on coming to us for primary care and emergent care. We can still safely care for people. There's a study that was done in New York where they actually realized that a lot of people with chronic diseases are no longer coming to the hospital. And the question that was asked was, why are we not seeing strokes? Why are we not seeing heart attacks? And it turns out that people are staying home to avoid being in the hospital because of COVID. We're trying to say to people, if you do have a need to be in the hospital, you should come in. Do not stay home. Come in so you can get the care that you need. Next slide, please. The other thing that we also need to understand is that we have put in measures in place across health systems to really ensure safety of patients and staff through several strategies. One is screening patients and visitors across health systems. We now have universal masking policies that allow us to ensure that people wear masks appropriately. We have visitor restrictions that limits the exposure of both our staff and individuals who come to the hospital. We have increased telehealth services. Right now, I just had a meeting earlier today in our division to talk about how do we ramp up virtual visits. And we're really working very hard to ensure that we can actually do video visits, but also to do telephone visits as needed for those who need it. Our preference is really to do video visits because that allows us to see the individuals and really provide, it's a better strategy than doing telephone visits. So we're trying to increase our ability to do video visits. And then the other thing we're also working on right now is the realization that some people may not be ideal for video visits because of bandwidth issues financial limitations. And so for those individuals and those who are really sick who need to come in, we're making sure we're creating an environment that is safe for them to come in. So we're creating separate areas for COVID-19 patients, and we're providing structure for our health system to ensure that people are safe if they come in. Next slide. The other area that we're working very hard on is to protect vulnerable populations. As you heard President Raymond say, the goal is to increase testing, and we're working rapidly to maximize our ability to test all populations regardless of ability to pay. So luckily for us, we as an organization, we were able to obtain additional funding to focus on the vulnerable populations of Milwaukee, specifically the African American population in Milwaukee. So as you all know, if you look at the data out there right now, the mortality rate from COVID is highest in the African American population. The risk of infection is higher. So we're trying to understand what's behind all of this. So we actually got funding from the Advancing Healthier Wisconsin Endowment to test African Americans living in senior housing, assisted living, nursing homes, or homeless shelters who are at particular risk. And the goal is to prevent the spread of COVID-19 in this population by reaching out ahead of schedule to identify, to screen, identify, and help manage individuals who may be at risk. So our goal is to reach about 1,000 elderly African Americans over the next 3 months. We have already gotten a partnership with about 30 senior housing sites. We're also collecting blood to be able to do COVID-19 antibodies. What this will allow us to do is, one, we'll identify people who are at risk, who actually have COVID-19, who may not know it, so we can actually send them to get treatment. We'll identify individuals who are not at risk, who don't have the infection, but a third group are those who already have antibodies. What that means is that they probably have some level of immunity to COVID, and so that will help us identify individuals who may actually be able to to help others who may actually be at risk. So the key thing we're also trying to do is to make sure we protect our staff at MCW. So this program is being run out of the Center for Advancing Population Science at MCW, funded by the Advancing Healthier Wisconsin Endowment. But we are making sure that all our staff have PPE to protect both our employees, but also the individuals we actually get in contact with. We've been able to partner with Frater Health to get PPE for everyone to do the antibody test. So again, that has been very, very helpful. We are also working really hard to identify potential ways to even expand this testing as we go forward, because once we learn from what we're doing right now, we should be able to do more in other communities. So this is an opportunity for us to really increase testing for the vulnerable populations, hopefully to really ensure that everyone has access to testing regardless of the ability to pay. So I will now transfer the presentation to Dr. Erica Arrington, who's going to talk about mental health.
Thank you, Dr. Ageti. First and foremost, focus on what is happening in the moment. Find healthy ways to take breaks and recharge mentally and emotionally. Gather your news once a day from a trusted, concise news source. Focus on what you can control and what you can do to make a positive difference during this time. And remember, you cannot control how others think, talk, feel, or act. Next slide, please. Take care of your mental health and the health of your family. There are many ways with which you can do this. First, look for ways to maintain a sense of normalcy through routines. Try new things together, in person or virtually. Reach out to friends and family. Even though we're physically distant, stay socially close. And schedule a daily check-in with yourself and the people you live with to notice and address your feelings. Next slide, please. Again, taking care of your mental health is very important. Please note there are several services that are now being offered through the Department of Psychiatry for both adults and children. Telehealth services, both telephone and virtual visits, are now offered. Again, through the Department of Psychiatry TOSA Center for Adults. Appointments, you can call 414-955-8900. And for children, please don't hesitate to call the Child Psychiatry Division. Again, we're doing telehealth services, both virtual, video visits, as well as telephone, and you can contact 414-266-2932, and there's several locations of clinics related to the Department of Psychiatry located in your area. I'd like to turn it over now to Dr. Perez.
Good evening. Thank you for tuning in. So I guess what I would like to do with the time remains before questions is to talk a little bit about the impact that we have seen in our community, namely just communities at large, but certainly on Milwaukee's South Side, that we've seen with COVID-19. And some of the efforts that we've started to employ to treat those presenting problems. Certainly, we are seeing an increase of anxiety in both existing patients and those that call in for an appointment. We're still open to new patients as normal, as we usually are. So definitely an increase of those who had pre-existing anxiety or depressive disorders. Certainly those that are other disorders like PTSD and other with child disorders, anxiety disorders in children, or those with poor coping skills in general. So we know that those who already have an existing mental health condition are particularly vulnerable to stressors in the outside environment, and this is certainly an example of a significant outside stressor. We know depression has been on the rise as of late, and that we've seen as a function of limited mobility and freedoms, or perceived sort of limitations on one's personal freedom, not being able to go and visit family members as fluidly as before, has affected a lot of our families. Also concerned for their families, concerned for their elderly, aunts, uncles, grandfathers, grandparents, or folks from other countries or country of origin. We have a lot of folks that have families from other communities or other, like Puerto Rico or Mexico, for example. And really just not knowing, there's an element of just the not knowing is promoting a lot of anxiety. Some of our providers have noted an increase in alcohol consumption. That's something that I've heard in other communities as well, but just an increased reliance on alcohol or substances to cope. We see some increase in family conflicts as there's not other avenues or outlets for outreaching for other social supports as easily as before. A few have said also that domestic violence, they've seen a little bit of more increase in just domestic disputes in their families. So all of these stressors, not to mention the stressors related to job loss, financial hardships, those are certainly exacerbating pre-existing conditions of mental health. So we also know that some families and individuals are decompensating at home the longer that it goes on, especially those who aren't leveraging other avenues of social support. Some people are real savvy with technology and they can use platforms like Zoom or FaceTime or what have you. And those that don't have normal interface with those elements, they feel much more closed off from other people. And we know that human beings are social creatures, so not having a sense of social support has had a negative impact. So, and some more than for others. Those who are connected to social networks seem to be doing a little bit better. Some of our adolescents that we treat, for example, they're very savvy with technology, so they've been able to enjoy those kinds of conversations and relationships virtually from their homes. However, we have seen an increase in depressive disorders among teenagers as well, because they can't go to the places that they normally go and they feel shut down and locked up in their homes. So it's sort of like a double-edged sword. We know that patients have been most surprisingly responsive to telehealth. We at the 16th Street, we have had limited telehealth, and now we've expanded telehealth to 48 providers that we have in our behavioral health department who are now using telehealth, telephonic and televisual solution. And they've been reporting that patients are literally now inviting the provider into their home, and providers are being innovative with having patients share their arts and crafts, playing instruments, showing their pets. So they're doing a lot of different things that they otherwise normally would not do within the confines of their therapy office. So this has been a new way to do the work, so to speak. So there has been some positive byproducts of using telehealth. So I think that there's some good things that are starting to emerge, though not without challenge, especially with clients who have limited telephone plans or they don't have access to internet. It's much harder for them to fluidly and confidently move forward with their therapy appointments if they don't have an unlimited data plan, for example. So they, by and large, expressed gratitude to being able to be checked on telephonically and are enjoying sort of an experience of continuing to be reached out to. So what we're telling patients and families about how to stay safe and mentally healthy during this time is most definitely staying connected as much as is possible without compromising their own health. Staying physically active, of course, very important. Using techniques like mindfulness and meditation, utilizing a journal to reflect on one's feelings, and recognizing that it's temporary, but in a way it'll be a new way of life moving forward. So we've also told our patients how important it is to extend help where you can, again, without compromising one's safety, and sharing resources and having game nights and virtual parties, if you will. In a more practical level, maintaining as much normalcy with regard to the sleep routine, having regular meals, hopefully meals together as families, 6 feet apart as much as that's possible, and limit excessive exposure to the news and social media. There's so much misinformation out there, and I know that there have been a lot of community members just getting their information and being really concerned about the source of truth. So just having patients be judicious about where they're hearing their news and limiting their perseveration with regards to social media has been one thing that we've been trying to put forward as a way to manage one's anxiety. So some key takeaways here is recognizing that the people who cope best in crisis are not those who focus on pursuing happiness to feel better. It's those who just cultivate hope and finding meaning despite the scariness of the situation that's occurring. So really promoting those kinds of mental health, looking at the world through those more mentally healthy lenses, I think will go a long way. Another thing I just want to make mention of before I end here is I know that the Milwaukee Community Health Centers are now expanding their testing to the general population, which is very, very exciting, and it's such an important sort of collaboration. So Southside patients can call 414-672-1353, which is the 16th Street Community Health Center's main line. And so this is diagnostic testing. It's not screening, that is now available to the general population if they feel that they have acquired some symptoms that they feel they need to be tested. There's an avenue to get tested in any of the 5 community health centers in Milwaukee. So, Corey, back to you.
Well, thank you, Dr. Perez, Dr. Arrington, Dr. Getty, Dr. Raymond, another all-star panel. Really appreciate you all's insights, and this focus in particular on behavioral health is obviously important as we are trying to help everyone in our community stay not only physically safe and well, but also mentally and emotionally safe and well. So we appreciate that additional perspective tonight. We're now going to open it up to questions that we've been receiving. You can continue to submit those if you've not already, but we're going to go to our off-camera announcer now for our first question, please.
Okay, thank you, Mr. Nettles. Yes, we have been receiving questions, and we're going to hope to get to all of these, but please do continue to submit them. So first up, I've heard some epidemiologists say that social distancing for as long as we have is just prolonging the surge and the peak of COVID-19, and that we should start reducing social distancing except for those that are high risk. What validity, if there is any, is there to this theory?
Well, I'll start. We always encourage different points of view, but I think that's would be extraordinarily difficult to really operationalize. So who's at risk? People over the age of 60, people with obesity, people with diabetes, people with hypertension. That's more than half of us. So I don't think that's a very practical approach. Also, who would like to volunteer to get coronavirus before we have a vaccine or a treatment? I think that would be very difficult to convince people that they should be out and about and not protecting themselves. So I personally, even though we encourage different points of view, I'm strongly opposed to that approach.
And I'll just weigh in also, if you look at a lot of the data we're using right now comes from work that was done, some of the work that was done in China, but also historical data from the Spanish flu. And it's very interesting if you look at what happened, there are a couple of cities. Denver was one of those cities where they made a decision to reopen the city before they had enough control of the virus, and they had a very significant surge in infection rates. So I think we need to look back at history, and that would help us make informed decisions in addition to the science that we have today. So it is not, I think we recognize that these shelter at home policies are challenging, but it is for the safety of everyone as much as possible. We need to try to stay to keep that process in place so that we can actually minimize the risk to the larger population.
Thank you. Are there any statistics on our homeless population who may have more of a challenge with social distancing? Are they able to stay safe and healthy during this pandemic?
So I can. So that is really one of the reasons why we are trying to increase testing for that population, because as we all know, it's really challenging. Certain populations have a hard time with social distancing. If you live in a shelter, if you're in a home where you have a lot of people living in the same space. And so for that population, I think it's going to be critical to identify those who are infected early on, to identify those who are not, and be able to provide treatment as soon as possible. So I think the best we're going to be able to do right now is to increase testing and make it available to as many people as possible.
There's some questions coming in regarding the return to normal life, which I know that we all wish to do so greatly. So I'm going to make this a two-part question here. When might it be safe to get back to normal life, like attend ball games, concerts, fly in planes, and so forth? And then can you discuss more about what we might expect in that new normal? Will we have to be taking our temperature when we go into stores and that sort of thing? Is that even legal?
Tough question. I don't think the new normal is going to be the same as the old normal. And I think most of us really just need to accept that there's going to be some need to have social distancing until we have a vaccine, and hopefully that vaccine works. And so those are really difficult questions. We don't think we're going to have a vaccine until early next year.
And also to add to that, I think we have experience from so countries like South Korea went through an earlier case of coronavirus a couple of years back. They actually developed a process of wearing face masks on a regular basis and very rapid screening and detection strategy. So I think the new normal for us is going to be a change from the old normal. I don't think for the next 18 to 24 months, life is going to return to how it used to be pre-COVID. I think realistically, we're going to actually have to wear more masks. We're going to probably practice rapid detection and testing as people get infected. We're going to be ready to surge as needed if things actually begin to show signs of escalation. So I think it's just going to be a system where we're going to have to adapt to a new normal, and that adaptation is going to require us to be willing to track and then treat as needed.
You know, I think Dr. Getty mentioned testing. It's very exciting that we have so much new testing capacity coming on board, and there's going to be more over the next month. That'll be probably the most important thing that we can do to slowly reopen our economy and resume some of the things that we love to do in our everyday life, take a walk outside, be able to spend time with people that don't live in our homes. but it's going to be a slow process.
Dr. Amon, you mentioned the testing. A question here regarding just that. When could we expect mass testing for asymptomatic people? And when should I ask my doctor if I can be tested?
Good question. The state has an arrangement with Promega and Exact Sciences to deliver 85,000 tests a week. So that's pretty good. And I think that the current labs also have other sources of testing for the virus. So I'd start asking now. What's even more exciting to me is some of the antibody tests that might be able to tell you whether you have had the disease and recuperated are coming online pretty soon. And some of these have been pretty well validated. You know, there are a lot of questions about the first antibody test that came on the market. But I think the ones that are going to be rolled out from, say, Abbott or Roche or Becton Dickinson are going to be really, really good tests. And if you compare the two tests together, the antibody test with the virus test, we're going to be able to learn a lot of things and maybe give people some comfort that it's relatively safe for them to resume some level of normal activities.
Okay, thank you. Some questions now about some mental health coming in. Psychiatry resources were limited before COVID-19 started. How can they be expanded for during the pandemic and then moving forward after it?
So psychiatry services in the area, there's an across the state, nationwide lack of resources in psychiatrists and psychiatric services. That's a known fact for both adults and especially for children. One of the ways with which we in the department are trying to expand access is through telehealth, opening up more opportunities for patients to have their care and services brought to them in their home. Whether it's a video version or a telephonic version, we are available, we're willing, and we are allowing not just attendings to have this form of care provided to patients. We're also doing the same for all of our trainee clinics, whether it's child psychiatry fellows or general psychiatry fellows. So we're trying to expand access as best as possible to reach everyone using a telehealth platform. One of the things to say is after, as things progress on with COVID and we have more time under our belts, we anticipate actually probable uptick and surge in terms of need for access in mental health services, just from the pure fact of the natural attrition and change that happens that's going to lend to more persons coming forth with mental health conditions such as depression and anxiety.
There's a general question about telehealth. If I want to be seen virtually and I'm a new patient, is that able to be done, or do I have to be an established patient to be seen virtually?
So at MCW, for both the adult side and the child psychiatry side, we're seeing new patients on a virtual fashion. It just depends. In the adult arena, they are seeing patients in both new patients in both a telephone and virtual video format. On the child psychiatry side at this time, we're doing only virtual visits from a video format, and we're looking at other possible ways to extend out. So there is opportunity now to establish and being a new patient through telehealth for both adults and children at the medical college.
I can say at the 16th Street, it's the same. We've expanded our ability to accept new patients. It's a little bit more challenging with children and adolescents only by virtue of just not having as many providers that serve children and adolescents. That was pre-COVID. But, you know, just I think really expanding opportunities for training and postdoc and just, you know, encouraging folks to get into the profession so that we can gain, you know, develop clinicians to meet the demand of child and adolescent services. But right now we're opening the doors to new patients.
And then to address primary care, so on the primary care side, we are able to do new patients by video visits, but we prefer not to do new patients by telephone. So if you are a new patient and you need to get seen, usually we can actually accommodate those individuals using video visits.
Yeah. And also to add on top of that, many of our psychiatry attendings as well as residents are integrated or embedded within primary health clinics. So you may not know this, but you may actually have access to a psychiatrist within your own primary care physician's office.
Great, thank you. What kind of resources are available for the at-risk communities once the pandemic is over, such as prevention, education, long-term access to assistance, etc.?
So I will start and then let others weigh in. So what we are trying to do from an MCW and Frater standpoint is, one, the emphasis right now is testing. And it's really to provide access to testing, because that is really going to be what changes the future of this pandemic. Same thing with antibody testing. Once we can do both, then we're going to have to come back to programs we've actually put in place to address housing instability, food insecurity. So we have several programs ongoing right now, both at the institutional level, at the Center for Advancing Population Science, where we actually have programs that focus on food insecurity, housing instability, issues around discrimination, so segregation. We're working on all of those programs, and I think the priority right now is testing. And once we can get a handle on the disease, then we can really go back to all the other programs that we have in place. And I think what this has made very clear now is that we need to invest resources beyond what we did in the past in terms of addressing some of these social issues that are becoming very evident now and are underlying the disparities that we're seeing in infection rate and mortality rate from COVID-19.
Thank you. Is there a plan to reach out to the general African American community in the Milwaukee area?
Absolutely. I mean, I think we are doing, as an institution, we are doing that already. Some of these webinars are designed to really provide information and reach out to individuals who are at risk. And we also, like I just described in one of the slides, we're actually increasing testing in the African American population, and we're trying to test for both infection and antibody. But then also in terms of programs that are designed to address the underlying social issues, we have several programs in place right now, like I said, that are focused on food insecurity, that are focused on incentives, financial incentives to mitigate stress and financial stress people face. And then we're also doing some work right now trying to understand at the community level, knowledge about COVID, barriers to testing, concerns about trust issues, and how do we actually help people really understand what is going on and really address this problem long term. Those are all things that are happening, and we're working on those strategies as we speak.
Okay, thank you. There's a lot of questions coming in regarding serving young people during this time, and especially those who might be seniors or the class of 2020 who are missing out on a lot of experiences that they were, of course, looking forward to. So how can we do more to serve those young people during this time? Is virtual mentoring a way that we have seen on the increase? But beyond that, what should we be offering young people to help them?
I love the idea of virtual mentoring. I think that's a wonderful phrase. I think that we're going to, this in the same way that the science is evolving quickly, so too will the science of psychology and community health be evolving alongside it. We can do a lot by way of helping those youth that are ushering into adulthood and they're graduating. First of all, by recognizing and validating that these are unprecedented times, but trying to ritualize that that transition and graduation, there might be other ways that we can ritualize that and honor it and celebrate it. You know, if not virtually, then eventually, you know, having opportunities maybe later this summer. It's, of course, it's hard to tell with the timeline and when things will, you know, start to get a little bit less restrictive. But I think the first step is to really validate just the difficulty and validating how, you know, this is a hard time for them. Finding ways to just helping them to celebrate it in a new way and to set forth later opportunities for them to celebrate it more formally. But the idea of mentoring, I think, has come up in some circles, and I think that we should do some work around that as community to try to find ways to create forums for mentoring those youth that are graduating or about to graduate.
I agree definitely with Dr. Perez, and recognizing that this is a significant milestone in life where many of us have fond memories in terms of graduating school or just these major milestones, whether it's graduation from school or other major events in our lives. And for them to not necessarily have a traditional opportunity to celebrate is quite impactful. And finding unique, out of the box ways in order to find a way to celebrate and acknowledge that those accomplishments is important at this time. And mentorship is always wonderful.
Thank you. How can we link other potential partners to MCW Center for Advancing Population Science initiative?
That's a very good question. So we do have we have a lot of community partners. We had about 50 community partners that we work with on an ongoing basis. And so I think in practical terms, one is reaching out to us, on our website. We have the ability for people to connect with us on our website, and also connecting with the MCW the Office of Communication will get you direct access to us as well. So we have several options through our community partners who are already working with us. They can connect you to us, going to our website and getting connected to us, but also working with the Office of Communications at MCW will get you the connection you need to be able to work with us.
Okay, we've briefly talked about this, but to what extent are community health workers being engaged in the work to serve the community during this crisis?
So I'll take it. I think both MCW and Frater Health have a network of community health workers. I think it depends on how you define the term community health worker, but we do have, in principle, when you think about someone who's familiar with the community, who understands the culture, who is connected to the community, both MCW and Frater Health at different levels have people who are embedded in the community. But the way we're also trying to extend that is to really use partnerships. So people who are key opinion leaders in the community, groups that already have established linkages with the community. These are the individuals we're partnering with right now to ensure that in addition to the teams that we have already, that we're actually leveraging their network and their resources to help us achieve what needs to be done. So I think it's going to take a village to really address some of these issues. And what we're hoping to do is this opens the door for us to actually begin to ask questions about how do we leverage real significant partnerships as this progresses. And I suspect that after this crisis, we are going to actually have to rethink the way we do business and how we actually partner, who are partners, who are individuals who rose up in this crisis, and we're able to help achieve the goal of helping the community. And it's going to become very evident as time goes on.
Okay, how long should we limit before we go to the dentist?
So I'm going to take a crack at this. I am not the expert on this, but I will. So I think this question has come up from several of our patients, and some of my patients who've asked the question, at what point do I go to the dentist? I think there are three groups of individuals. Obviously, if you have a crisis right now, you're in pain, you need to see a dentist, you should go. I mean, if you're sick and you need to get sick, you need to go, and that cannot wait. The second group are those who have who have the option of delaying before they get services. So maybe someone who can wait a little while to get things done. I think it's I would say call your dentist. Based on their comfort level, they should be able to tell you when they are ready to accommodate you. And then the third group are those who have elective or who have a routine visit. I think it's going to be based on your comfort level as an individual to determine, do I feel comfortable going in, and then calling your dentist to get feedback. So that's kind of the approach I've shared with my patients as they've called about what to do.
Can you address the length a virus can be swept along in a breeze, such as if you pass a jogger or a biker, or you come up walking behind someone? Does it matter if they're breathing hard? Can you speak to the to how the virus can be caught in those sorts of situations?
I think this is a situation where there's a lot of information and much of it isn't very useful. The best thing that we could do is to wear cloth face coverings when we're out in public and hope that the jogger or the biker is doing the same thing, and to do our very best to not be in their 6-foot space bubble for very long. If somebody just walks past you and they breathe and you're outside, it's very unlikely that you're going to get the virus. But the whole idea is to minimize that contact.
Speaking of the cloth face coverings, there's much confusion about them. Many think that these masks are not effective in protecting the wearer. Can you address this? What if the cloth mask is doubled or has another layer of insulation?
I think the main reason to wear a cloth face covering is to protect people around you rather than to protect you from them. But I think a nice thick cotton cloth, flannel, a doubled or quadrupled t-shirt is going to give you some level of protection. What I recommend is there's a really good section on the Centers for Disease Control website that talks about cloth face coverings and gives you good information about how to make them and what level of protection you can get from them.
Can you speak more about isolating infected patients that do not require hospitalization in the household? What do you recommend? And what if isolation in the household is not possible?
So I think the very first thing to think about is one is to identify an area of the house where the individual who is infected can actually stay. To minimize contact with other members of the household. Obviously, in some situations, it's not ideal, but whatever you can do to identify maybe a room in the house, maybe a second part of the house where they can actually stay, making sure that whatever they use, you wipe down surfaces on a regular basis, having a schedule for wiping down surfaces is going to be critical. If there's a way to isolate that individual to use one bathroom as opposed to a sharing bathroom for everyone, that's also ideal. But I think whatever you can do in your situation, to identify an area where that individual can stay, use where they can go get food without interacting with other people during that period of time, maintaining that 6 feet distance. All of those are things that can be done. But I would say, finding a space for them, regular hand washing, wiping down surfaces as much as possible, trying to find, that distance that allows the individual to not feel separated from everyone, but also enough distance to maintain, the isolation that's necessary. Those are the things that can be done.
Can humans get COVID-19 from their pets, or can pets contract it?
We all love our pets, and I think most people know that tigers have gotten sick supposedly from COVID-19, and that there have been some pets, cats and dogs, that have tested positive. We don't know how good the test was. What I would say is, if you're home with your pet and they're not interacting with other pets and other people, you're safe. If your pet is interacting with other dogs and cats and their owners might have been sick, probably you're still safe, but the risk there might be a little risk to it. But we have two mental health professionals on here, and I would say you probably would weigh in. Pets are good for us, especially when we're isolated. And the last thing we want to do is encourage people to not interact with their pets.
Pets are very loving and therapeutic, and they provide a lot of support and a lot of support, especially for those who may be having a sense of loneliness at this time. To my knowledge, there hasn't been any literature that I've come across where we should be concerned for transmission from our pets.
And one other point is that coronaviruses have been around with cats, so it is not. The question is always, are they transmitting COVID-19? Because there are other coronaviruses that are not COVID-19, and so again, along with what everyone else has said, I don't think at this time we should be avoiding our pets. I actually think this is the time to embrace whatever helps you, deal with the social isolation.
I would concur. Yeah, definitely.
Okay, thank you. Are there plans being developed to get patients back into Frater to see their MCW physicians and continue with follow-up cares as needed?
Yes. The sooner we can get back to having our patients interact with our providers, the better. And, we're following the Safer at Home guidelines, but I believe that within the next week or so, we're going to be able to resume some level of primary care. And Dr. Getty, you're probably right in the middle of that planning.
So we are actually working there's a whole team in place right now evaluating how do we really ensure that we can actually see patients. So many of us are very concerned that people who are sick, who have other chronic conditions, are not getting seen. And so one of the things we've actually done right now is to ramp up the ability to do video visits. So right now at MCW Frater clinics, we have the ability to do video visits, and we're expecting that after May 4th, we should be able to do additional in-person visits as needed. So I think the summary of this is that we have the ability and we are able to provide those services, and so people who need to come in should feel free to come in.
If I could just add, it isn't just Frater and MCW, it's our federally qualified health centers and community clinics, and all the health systems in the region are eager to resume normal activity as soon as we can.
At the 16th Street, in our behavioral health department, just as an aside, we have a few providers who are still in clinic, not doing face-to-face, but doing telehealth, and so those same individuals, we would probably start with a plan to do re-entry in a really strategic way, in a gradual way, in a socially distant, socially responsible way. We want nothing more than to get back to treating our patients face-to-face.
I think testing will help all of us make good decisions, and it would be great if you knew that your mental health provider or your physician or your advanced practice provider had tested negative for COVID-19 recently. That would give you some level of confidence that it was safe to come back into the clinic.
Very good, thank you. The next questions actually are in regards to testing again. When the antibody test is available, how is it being administered? Currently, you need symptoms to be tested.
So the way the antibody test is designed is a blood test, so you actually need to have a blood draw, and it is designed to identify the two antibodies that are generally identified for in cases like this. One is what is called IgG, and the other is IgM. And the reason why some tests are not reliable is because they're based on IgM, which sometimes the values fluctuate over time. And so most of the tests that have been approved that are likely to be very helpful tend to go after the IgG, which takes a little bit longer to develop, but when you develop them, they last longer in the blood. So the expectation is that once we have that, I know we are at the verge of getting those tests available. Once we have those tests available, we can actually test people and we can actually say, well, in the past 2 weeks, you've actually been exposed to COVID, and somehow your body mounted an immune response to it, and which will be reassuring for individuals, especially if you realize that you actually didn't get sick as a result of it. It's actually very reassuring. So we expect that in the next 2 to 4 weeks, those tests are going to be available at the institution and at many other sites within the Milwaukee area.
Just have about 5 minutes left here. We'll try to get these last questions in. Can we expect to have immunity if exposed to COVID-19, or will it be like the flu where we can get it over and over again seasonally?
We don't know. We hope that at least for a few months that there'll be some immunity. And what I would say is, unlike the flu, the coronavirus doesn't mutate very often. And so we can hope that if you get it once, maybe you've got good immunity for at least the season, if not into the next year, but we just don't know.
In fact, the next question was regards to a vaccine being developed, and asking if the coronavirus is from the same group as that which generates the common cold. So can you just speak to that with the differences in mutation that you just mentioned?
Coronaviruses have been around a long time, like Dr. Aghetti said, and they do cause the common cold. People have tried to raise antibodies or make a vaccine to these coronaviruses, not just in people, but in veterinary medicine, and have not had very good success in the past. So we're hoping we can do better with this coronavirus, but we just don't know.
Okay, thank you. And then finally tonight, there have been much discussion tonight regarding concerns over patients' long-term health, both physically and mentally. Are you creating a preparedness plan to deal with those health issues, and can you speak to what that might be?
So I'll talk about the medical aspect, and I'll let the mental health folks kind of weigh in. So what we are doing right now as an institution is we are tracking every individual who has had COVID-19 exposure, and we're actually trying to track them out up to 6 months after the exposure, because one of the things we're trying to understand is, one, who does well, who doesn't do well with COVID-19. But the second factor is what happens to people after exposure. Are we having people who are going to come back with long-term sequelae of COVID-19? Are people going to get reinfected over time? So we want to have enough information to understand what happens to people at least 6 months out. Eventually, I suspect we're going to be doing something longer than that, but in the initial plan right now is to track for at least 6 months to get a better sense of what happens after a COVID infection.
I think from a mental health perspective, as we look at preparedness moving forward, we have to look at how to, help enhance people's resiliency overall. Just resiliency, mental health resiliency, trying to boost a balanced lifestyle, and that includes also just choices around media exposure, trying to get out in nature a little bit more, just balance in general, I think. And then also better management, really working at other ways to help existing mental health problems to better manage those, because we know that those are the individuals who, from a mental health perspective, are most susceptible to persistent and pervasive furthering of mental health problems.
And if an aspect of the question was people that don't have COVID-19 right now and catching up with their other health conditions, I think every health system and every clinic is doing their best to have a plan to rapidly reintegrate those people and make sure that we didn't lose any time with their chronic disease.
Okay, thank you, Dr. Raymond and panelists. I will turn it back over now to Mr. Nettles to wrap up our seminar.
Great, well, thank you to our entire community for joining us on the town hall today. In particular, we thank our questioners for your thoughtful questions, and we hope the information that you've received here will be useful to you and your family members in staying safe. from COVID-19. I also want to thank each one of our panelists, Dr. Arrington, Dr. Perez, Dr. Aghetti, and Dr. Raymond. Thank you for not only your time tonight, but for all the outstanding work that you're doing all across our community, not only in response to COVID-19, but even more generally. So thank you all for your efforts. And we hope that you all at our town hall audience will join us again here next week, where we promise to have another all-star group of panelists bringing trusted, accurate information to you to keep us all safe and well from COVID-19 and beyond. Thank you and have a good evening.
Thank you.
Good night. Thank you.